I am a registered mental health nurse. In time, it may not be appropriate to be nursing such an inmate behind segregation. I said that we need to ensure that our evidence-based practice is in line with clinical effectiveness.
Hello, everyone, and welcome to Nurse Nzi Careers. And this is a Nurse Like Me podcast. This series, we are looking at different professionals who are either nurses or consultants or have their own businesses. And this is to try and educate, inspire, and create awareness of career roles and career paths that nurses can go into. Welcome to A Nurse Like Me. Today we've got our beautiful guest, Angela Acquah, who is a mental health nurse by background. She's going to tell us a bit about her career in nursing. Thank you, Nurse Angela, for joining me today. Please, can you introduce yourself for those who don't know who you are?
Hello, thank you, Nzi. My name is Nurse Angela Acquah. I am a registered mental health nurse practitioner. I have been practicing for the past 7 years now, and I have actually served in many roles. I have worked in the acute sector. I went down into the prison route, and from the prison route, I went down to a rehab, which I also served as a senior mental health practitioner. And I went over to do more of consultancy work to various support providers in the leading cares, and that is in the regions of the Midlands. And then my journey, it did not end there. There was more bursting out of me. I went down to the West Midlands and actually furthered my practitioner role in emerging as a manager of a well-known organization where I actively participated in patient management, recruitment, and administrational tasks, and also engaging with the inspection and making sure that we adhere to the policy regiments as a healthcare sector. I am a mom, I'm married, and I actually manage my home together with the hectic responsibility as a nurse. And I also serve my community with some voluntary services, which I'm currently into. So here I am with you to actually talk to Nzi. If any of the viewers would like any suggestions, I'm also here to actually empower an individual out there if you want to take up a role as a nurse. Yep.
Amazing. Thank you so much.
You.
It sounds like you've got a diverse set of skills and experience. So, what would you say made you want to become a nurse? What was the thing that made you decide to go into nursing? And also, can you specify what type of nurse you are? Are you a mental health nurse, adult nurse, pediatric nurse, learning disabilities? What sector do you fall under?
Okay, so I am a registered mental health nurse. That is my core profession. However, I have bridged it across and actually got myself to actually nurse in the learning disability sector as well. So I do the learning disability sector nursing, and at the same time, I do the mental health. My journey, oh dear, it stems from afar. I think it's just a passion that burst out from me. From having a preterm baby and looking at how hardworking the nurses worked with me during those times in the hospital challenged my inner core belief to give back to the society. And I actually supported the nurses to understand and to practically know what they were actually involved in, the nursing of individuals in the hospital, and also to challenge myself by getting to know what I'm getting myself into. So I took the bold stand and acquired a job with one of the community services as a healthcare. So from the healthcare role, I challenged myself with the passion in me to actually follow up my dreams and to give up. I eventually landed myself an application from one of the leading universities. And even when I actually got that, I was actually rejected. And they made it clear to me that before you can be accepted into a university, you need an access course. So I had to go back and start from the grassroots, which I went in, did the access to health, access to nursing, health, and midwifery, which got me into the university. And I will say that it was a milestone, but with dedication, passion, and an inner burning desire, I was able to attain the degree that has got me here today. Yeah.
Wow, that's very powerful.
Thank you.
Thank you so much for sharing that. So you mentioned that you managed to bridge into learning disability. How did you do that if you are a qualified mental health nurse? What did you have to do to get into learning disability?
Okay. I think it was all out of curiosity for me and actually broadening my horizon, that is challenging my inner core and my skills expertise. I think it's just the course of life, actually, with the job that I came across. I didn't have the drive to just go into it. I think it was a passion. I wanted to find out more of what was happening with those client group. And I just applied to it and then got myself in there. And with a registration as a mental health nurse, you've got the right and the skills to actually work in a learning disability field. And when I went there, I decided I really discovered myself that this was something that I wanted to do. And not only wanting to do, I wanted to find out more about what that concept of nursing was all about. So I began working with them. From the beginning, it was a bit daunting because with mental health, you only deal with the cognitive side of things and medication management. But with learning disability, you deal with the cognitive side, you deal with physical, and you deal with the disability side of things. So it's more of a biological factor that is actually being supported for an individual to live in the community and thrive in. And with that perspective, following the challenges in the mental health sector and the challenges in the learning disability sector, I decided to place myself in the middle and learn the skills, and then I can actually come out with a major, whether I wanted to stay in mental health or I wanted to stay in learning disability. And overall, I felt I wanted to do both of them. So I landed myself in where my roles are actually being shared equally among the team, still assessing for the cognitive side of things and still assessing for the disability, and actually helping individuals to live right in the community. Yeah.
I love that because you've actually touched on a really good point, which is there is an overlap sometimes, isn't there?
Yes.
Like, for example, within certain nursing roles, like you could work on an acute psychiatric ward as an adult nurse, but you're dealing with the physical needs of that person,
Yes.
whilst the mental health nurses will come in and deal with the mental health side of things.
Yes.
And I think very much in the social care aspect of things, there is a lot of learning disability service users, and that is where you see a lot of the overlap. Like, I am an adult nurse. I have a background in mental health. I did mental health nursing as a support worker. Then I went into working in a psychiatric care home. So I've gained mental health experience, but my background is adult nursing. And I also had a moment when I did GPN nursing where I worked with children. And so there is that element of overlap where you can be a specific nurse but working with a range of different people. Did you find that that was something that you enjoyed, being able to work with that groups, with different groups of people? Is that something that you've got a passion for? Is that something that you enjoy being able to do as a nurse?
Yes, I think it was very interesting, and actually I enjoyed doing both roles, because if you look at a mental health nurse, the mental health nurse is only dealing with the cognitive aspect of health and well-being, whereas there are limitations to the aspect of nursing when it comes to physical health and learning disability. There is that limitations on that. But whereby I've been able to cross, it gives me the greater perspective and greater working, dealing with the disability, dealing with the physical side of things, and also dealing with the mental. Is a fulfillment, and that is the role of a nurse. And that is, I think that is the passion that I actually wanted, and to explore more and to actually brace myself with further skills in the job performance. And this has actually helped me greatly, because currently I'm being offered physical health training to do with the physical side of things, monitoring metabolics, which we don't normally have to do as a mental health nurse. So bridging that gap for me has really enlightened me in the role, and it's actually bring a wholesome into the nursing role rather than being partly adhered to or partly performed. Yeah, and I've really enjoyed it so far. It's been one of the most amazing journey that I've had, not being limited in your scope of practice, but it has broadened the horizon for me. Yeah.
I think it's just so wonderful to see how people's experiences have shaped their career. So what would you say to someone who possibly may be thinking of wanting to go into nursing but isn't quite sure what area to go into? I know we spoke about the overlaps in some of the services, and how sometimes even as a mental health nurse you can be dealing with the physical aspects of things, and as an adult nurse I can be dealing with the mental health aspects of things. But what would you say to someone who's thinking about nursing but just isn't sure, especially with the climate that we're in now? I mean, there's student nurses who are struggling to get a job within the NHS. What would your advice be?
Yeah, I think nursing should be inwardly driven. That is one core element. However, many find their roots in nursing and later on realize that it's not a passion, or in a way they just get a bit knocked off the road. However, for you to ensure that you are certified for this role, you've got to actually do a self-evaluation. Is this something that you really want to go into? So there are many factors that you could actually get yourself in, getting an access course done. Currently there is a course that is to do with the college, that they actually educate you on all the aspects of health and social care. And that is enabling you to have a taster of being a nurse, a physio, or any other health allied profession that you want to do. This, by the end of the year, will actually bring into line with you what you really want to do, because going for placements in these colleges will give you a taster ground as to whether this is what is for me or this is not what is for me. Also, when you decide to go and do the training and you come out as a qualified, you've got to actually challenge yourself that this is not a job for the weak, because the nursing job, it covers long, prolonged hours on shift. We've got to work with many people of different diverse of culture. We've got to work with different professionals. So you're coming in a field whereby it is challenging. So your mindset needs to be in a way that you are able to perform at your top optimum. And this, if you decide on all this, you would come to a conclusion and say, look, this is for me, or this is not for me. Looking at the courses that we do, nurses spend 50% of their training hours in placement and 50% in theory. So if along the side, you are not having that desire, that passion in there, it should quickly tell you that this is not for me, or this is for me. However, due to the political nature of things, many get themselves enrolled in the nursing field and realize that when they come out to the real world, it's not what is actually depicted. They tend to think otherwise. The actual does not reflect what you see when you are training. So just be mindful that you are mentally prepared when you are actually getting yourself to enroll in the nursing course. It is a rewarding career, and it can also be challenging at the same time. Education is the gateway to many nurses becoming very efficient in their job. And I believe that when you have evaluated yourself, you will be able to tell whether you are fit for purpose, you are fit to perform, and you are fit to be a nurse, which many look up to in our health sectors.
Amazing. I took so much from what you said. And just to kind of summarize, what I've understood is that it's not by force. And I love that
right.
You said, because I think, you know, a lot of people start nursing and think, well, I've started, let me just finish. Or they think that, you know, they're going in there for one thing. But I love the fact that you said, evaluate yourself, figure out whether this is truly for you, because it's not by force. You don't have to become a nurse. You can go somewhere else. You can take your skills, even if you've just done 1 year in nursing school and you decide it's not for you, it's better you leave than to carry on and finish, and then you get to a place where you're now stuck because it's not your passion. It's not what you really want to do. So I love that you said that. And you said basically to prepare yourself mentally for nursing. I think that is great advice, because there is so much that goes into it, from the placements to the assignments to just positioning yourself to be a nurse that not only goes on the ward and just systematically does things, but is forward thinking, is thinking pragmatically, is thinking analytically. You know, these are what people are looking for right now within nursing. They're not just looking for nurses to come in, look after people and go home. They want nurses to speak up, to speak out, and to be bold. You can, you know, you can progress within your nursing career. And when you look at the career progression for nurses, it is more leadership, it is more analytical, it is more operational. You are managing people now, not just your patients. So I love the fact that you mentioned that. And just something else you mentioned was about, you know, doing like a tester session just to see whether actually this is for me, doing an access course and figuring out whether it is for you, and shifting your mindset. So that all of that, I think, is super great advice. I think people can benefit a lot from just speaking to themselves, getting to know who they are and whether nursing is the path that they want, because it is such a rewarding career. It is a career that opens so many doors. And I think sometimes because of the backlash, nursing as a career gets such a negative connotation. But it's like, there's this saying that nursing is a calling and not a job. And it truly does feel like that, because every day is not going to be perfect. It's not going to be rainbows and puppies. But when you love something, even when it's hard, you still push through, you still go ahead and give it your all, because that's what you love. You know, it's like you love your family. Not everybody's going to get on, not everybody's going to be happy, but that's your family and you love them anyway. And that's kind of how I see nursing. And to be honest, that's why I've started this series, is that there is so many bad press around nursing, but there is such a broad avenue and spectrum of different jobs that you can go into. So even if you don't want to be a nurse that works on a ward, you can go in the community, you can go into social care nursing. I work in adult social care and I'm an adult nurse. I never thought that I could work in a supported living environment as a nurse, because we didn't know that we could do that, but now we do. So the possibilities are really endless in terms of what we can do with nursing. I wanted to touch a little bit about your experience working in the prisons. You said that you had time working in the prisons. How was that for you? I hear a lot of nurses looking into kind of venturing in prison nursing. How did you find that?
I think my prison nursing career was another pathway for me. And I think it's all about the passion and the calling. Nursing in itself is a calling. And I think if you have it, regardless of the challenge, you keep going. In the nursing in prison, we've got the primary healthcare nurses and we've got the senior mental health nurses. So the primary healthcare nurses, they go in and they do the normal daily medication administration, they take up the physical observations, and they do all the nursing bits. However, when you are a senior nurse practitioner, you actually become an assessor. So individual client group that may be allocated under your caseload, you work extensively with them. We try to assess, we try to identify their problems, and then we try to identify the pathway of treatment for them. And I will say that sometimes there are limitations as to the extent whereby you can support a prison nurse as compared to when they are in the ward setting. Because as a mental health nurse, a daily shift may comprise of you going in to ensure that a prisoner or an inmate in a segregation is actually being supported with their medical needs without really jeopardizing or causing them harm while they are in there. However, it's also at the same time difficult, with especially when you've got an inmate that may have delusional ideations ongoing and probably having challenging behaviors and actually being left to be in a segregation by themselves. This is where the controversy comes in. The nurse will go in and do their job, and the mental health nurse will go in and do their job. But the fact is that at the point in time, it may not be appropriate to be nursing such an inmate behind segregation. So I felt at that point in time, my job was inconclusive because I wanted to do more for patients. But at the point in time, a patient had been brought in as a prisoner, or as the public rules term it, as a criminal. There is limitations as to the role expectations that we can adhere. So we can do the bare minimum for them. And when it comes to a point where you want to go more, you are actually limited. And with that, once again, on my self-evaluation, I wasn't having the fulfillment at all. So I wanted to go more and more and more for patients. But where is the limitation, it stops you from doing your job. Therefore, I had to actually continue my journey, which my journey took me back into the community. And in the community, you can do more with your patients, But being a prison nurse is an interesting one. If you want to have the different aspects of community nurses to do with forensic, dealing with people who have alcohol problems, people who have drug substances misuse, this is an opportunity that you can go there and have an insight as to the different kind of client group that we deal with. And I think from there, you can go back to the community and then major in the field that you want to actually ascribe to as a nurse. A very fabulous journey for me, Nzi. And I think it was insightful. That is what I can actually highlight on my journey in the prison. Yeah.
I'm just learning so much today from you, because again, many people don't know that with a mental health nursing degree, they can go into prison nursing. They think prison nursing, oh, it's probably physical health. It's probably adult nurses that can go into that sector. So they tend to stay away from there. But actually, with what you're saying is just so insightful, because it shows that your skills as a mental health nurse is just as valuable as any other nurses that go
That's
into.
right.
And you've mentioned something that another nurse that I interviewed mentioned as well. And she's kind of like a very senior management level. And she mentioned that the limitations sometimes when you go into certain places, there are limitations based on your role and where you are. So she
That's
was
right.
saying when she was at a lower level role, but she obviously had higher level positions before, she wasn't able to make much of an impact because her role now was more clinical than it was operational. And so she also had to leave in order to be positioned in a place where she could make decisions in regards to care that was being made. She could work with leaders and influence their decision and guide them in terms of how to take care of the place that they had. So when you're at that senior level management, you're looking after the leaders within those teams, because you're looking around to see who needs support, what type of support do they need in order to manage those teams. And she was saying, if you're a band 6 or 7, you don't really have the same impact or authority as a band 8A, 8B. And she said the same thing that you did, which was the limitations. She was limited in her ability to make impactful decisions. So I applaud you for, going after what you think will help you to provide the most support. You didn't kind of settle, you didn't think, right, this is a career, I can't be moving around too much. You thought to yourself, how can I be more impactful with my experience and my skills? And that led you to a different career path. So I really applaud you on that. And I think something else you touched on is knowing your limits.
That's right.
Knowing where your limits are. That is very important, because you don't want to act beyond that. So thank you for mentioning that. That was very, very much key. And I think I'm definitely taking that with me. Did you face certain challenges within your career path? So obviously we love nursing, but were there anything within your experience as a nurse that became a bit challenging for you?
Yes, I think the challenge is there and is on a day-to-day basis. There are limitations to the scope of practice, and one has to be very reflective when actually doing the role of the nurse. When you reach a certain aspect of your role, you will see yourself analytically making decisions. And these decisions sometimes may need to be made to actually save a life. And it may come a time that some of the decisions may not be easily acceptable by a team member or by a colleague. But as a nurse, we are being taught from the very onset that we need to ensure that our evidence-based practice is in line with clinical effectiveness. It's not about going into a unit and getting in line and in tune with a culture to thrive. There are some cultures that may come out as very toxic. And as an individual going in there, you can't make a change for many to thrive. I have been in situations whereby a lot of bullying has actually incurred in workplaces. And when you tend to even try to speak about it, you may have a lot of negative connotations in relation to you speaking up. But as an individual in the nursing field, one skill should be predominant, and that is the skill of tenacity. Being able to thrive in the midst of adversity is paramount to the role as a nurse. I have faced a lot of bullying. I have faced discrimination. I have faced all sorts of abuse on the units. But I will say that I'm so thriving. And the reason being is that when you face all these challenges and you work according to the nursing and midwifery conduct, there are support organizations that will come in and help you. Regardless of the support, I think the persona of the individual, that is yourself as a nurse, should be able to remark a threshold of conduct so that that abuse, that bullying can be brought to the limelight, whereby it can be dealt tactfully, that it will be eliminated and not to be continued. We have talked about this in many newspapers. Many people go into those sections and actually become burnt out. And a lot of institutions have reported on staff hemorrhaging, and that is in line with not having adequate staffing in place. Those kind of businesses or those kind of health sectors would need to actually conduct investigation as to what is actually happening. Why are we not having adequate staffing? Why is staff turnover very low? And these, if you tend to find out, or if you tend to do a research, you will identify that it may be constituting to bullying, harassment, and all these negative connotations that actually apply to our nursing field. I have gone through that. I have actually stood against those kind of bullying. It may take a toll out of your life. It may get you bent out. It may get you crying. It may get you depressed. But you have to once again evaluate yourself. The role is not for the weak. And nobody is going to make you feel less of yourself, because you are in there to save life. So you need to speak up at all times. The earlier you speak up, the earlier you get help. You just don't keep quiet and continue and then go home and then moan and then actually cry, and eventually what happens? You leave the job. I leave a job basically because I want to actually move on. I leave a job role basically because I want a deeper meaning into my calling. That is a deeper role. I may be overflowing, let's say a container, you have water, the water is overflowing. So when I feel like I am overflowing at that set time, I move on to a new challenging role. But bullying, harassment, discrimination at the workplace are very, very eminent. And these kind of cultures are done very subtly, that you don't see it in the glare daylight. And when you try to talk about it, you may be perceived as a troublemaker. But those things need to be talked about, because the people that do that, they know it's against the law. And it will shock you, Nzi, that the main perpetrators of these kind of actions may be managers. I've come across managers that have actually been the main perpetrators of abuse, and they spiral it across the corridors. So if a manager is actually the perpetrator of an abuse, definitely it's going to actually impact on the ward, performance, attendance, and also the workforce level in the environment. I will urge all managers and all other competent nurses to play an effective leadership role to eliminate these kind of behaviors in the ward. Make the ward safe for incoming nurses to feel safe to work and not to be bullied. If all healthcare sectors would actually enforce a positive behavior and also an environment that is safe to actually bring forth new generational nurses, I think we would actually not be having short of nurses on the wards. The nurses are tired, they've been abused, and therefore they will leave. And when they leave, we end up using agency nurses to fill up immediate short vacant position. And it doesn't really foster continuation of care, but actually gaps in the practice that we are actually cultivating. I've been there, I've been knocked down, but I'm still standing easy because we know it's a calling. And when you have the calling, you keep going forward. I'll end here.
Amazing. Thank you for that. It's never easy to talk about, you know, experiences like bullying. I think the RCN published a survey that showed about 35% of nurses have experienced bullying, harassment, or abuse at work, either from patients, relatives, member of the public, and like you said, management. So it is very much a real thing that exists. And I think you've touched on the fact that there's been some reports about bullying, but specifically bullying of the BAME nurses. And I think you've summarized it very, very nicely in that, you know, these things do happen and it's not a reason to leave. There are protocols in place to deal with things like bullying. There are processes in place to do with things like bullying. I went to an event, and at this event, they basically asked me if a manager was causing issues, let's say was subtly bullying a nurse, what should they do? And I basically said to them that that's what your HR is there for. Contact a HR person, contact people that are going to be neutral, that are going to hear your side of the story and are going to direct you in terms of how you should deal with this person. If it's somebody that you can talk to and have a resolution, then by all means, let that be the first point, because they will always ask you, have you told the person or have you spoken to the person? But there are some people that are just not reasonable, and therefore you have to kind of deal with it in the right way, which is, again, put in a complaint against that person, speak to your HR teams, and they will handle it in a very professional manner that will be new. You've also got your unions.
I had some dealings with the RCN, that is on 2 occasions, and I think I personally navigated the issue, because these unions are there to support us, but indirectly, most of the times you find out that the bridges or the disputes are not really resolved. And you could find out that the nurse or the individual that is actually being bullied turn out to be the culprit. Meanwhile, it shouldn't be like that. So what I would actually advise individuals in this section is, if you've got any bullying harassment, make sure that you are following the protocol. That is the duty of conduct from NMC. If you make sure your behavior, your conduct is in line, and you believe that the union are still not helping you, reach out for further help, get advice, and make sure that the advice you are getting are from the right source. Because with the advice, when you go in to see a union member, the union member would have to work as it's meant to be. We see situations where most cases are camouflaged. And when I say camouflage, that means that it's covered up. Sometimes we need to call a spade a spade. I, for one, I believe as a manager, I've been there. And I always tell myself that do as you do unto others as you want to be done to you. People get carried away by titles, but remember, if you are in leadership position, you are being entrusted many. Many are in your care, and you become a shepherd. And a shepherd has to be of good nature so that you can breed further flocks in the industry to care for life solely. But when you are being granted a shepherd, that means you are in leadership position, but you've got an evidence of toxicity in you yourself. How do you actually manage your leadership qualities? This is the question that I throw to all leaders out there. And I believe if anyone is listening to me in a leadership position, they will take some positive advice from this, as I shared with you, Nzi.
That is so important. That is so, so important. One of the things that I love so much about my manager right now is that she's not someone that passes blame. She kind of looks to resolve. So even if she knows someone's maybe acting outside of what they should be, she has a way that she speaks to people that makes you reflect on your own conduct. Instead of accusatory, it's a tone of support, it's a tone of, collaborative working. So what is my role as your manager to make your job more suitable to you? How can I help you give the best that you can give within your role? Because essentially your managers are there to help you fulfill your duties. They're there to ensure that you fulfill your duties, to supervise you and give you the right tools to be able to flourish within your position. They're not there to micromanage.
That's right.
Managing. I think that's the worst thing ever, because you don't grow. If someone is micromanaging you, the moment they disappear, you won't know what to do, because they're always there to put out fires. But I think sometimes people need to fall in order to realize what they need to do to stand. So again, you hit the nail on the head there by saying that think about your management and leadership skills. Think about what you are, because people are looking up to you. There is a standard that needs to be upheld, and you are kind of somebody that you're pacing. You're a pacemaker. So people are looking to you to then figure out how to respond, how to then provide the best possible, work that they can. So again, it's really important to reflect, whether you're in leadership, whether you're a band 5 nurse. Reflection is going to take you so far. Do you have any final thoughts? Is there anything that you want to leave people with?
Yes. I think being a nurse, you've got to get the passion. With the passion, the right attitude, the right knowledge, you'll be able to thrive. Nursing is not for the weak. I always say this. And in nursing, you should always consider that you are being entrusted lives. So before you even think about becoming a nurse, you need to actually do a self-check. Am I fit for many lives to be entrusted in my care? If you find yourself in that bracket, then I think the way forward maybe is promising for you. But if you feel, okay, sometimes I can't cope with myself, how much more I'm going to, please reconsider when you are actually picking this role, because we need upcoming nurses who have passion for the job, who have the desire for the job, who have the zeal to come in and do the job collaboratively with us already in there, so that we can actually promote well-being physically, mentally, and socially in the communities, to aspire new coming nurses to perform effectively. Also, I would suggest that you've got to actually have tenacity that will keep you in there. Because if you don't have it, it will knock you off. I talked about abuse. I talk about the different sectors that I actually worked in. These required a lot of analytical decisions to be made, which can be a tax on its own. And being a nurse requires creativity. So developing skill base and being creative, it will help you spiral. It will help you navigate your course. And this will bring about the best out of you. For me, it has been a rewarding career, and I'm still here. So we are welcoming any new incomers that wants to join us in the field. to look after health. And always speak up when you see things are not being done right. I'm sure the Nursing and Midwifery Council want to promote good practices everywhere, and always practice with evidence-based practice to bridge the gap with clinical practice at all times. That will make you stand out in your career as a nurse. Thank you so much, Nzi.
Thank you so much. Oh my goodness. I have thoroughly enjoyed this conversation. I have learned so much, and I will definitely be taking evidence-based practice in line with experience. Avoid burnout, speak up if you see something wrong, and have passion, have a zeal for this career, because it's going to throw a lot at you, but you've got lives in your hands. So be full of passion, full of love for what you're doing, because
that's right.
The calling. So I love that. Thank you so much, Nurse.
You're welcome.
And so, guys, if you want to contact Nurse Angela, her email address. I can't speak today. Her email address is nurseangelauk@gmail.com, and you can find her on social media as Nurse Angie UK. Have I got that right?
Yes, you could check me out there for more informative and mental health education, empowerment, and also growing as a nurse and actually staying in as a nurse. Yeah. All right.
Yes. And Nurse Angela also does mentoring and coaching for nurses and prospective nurses, so student nurses alike. If you are looking for someone who absolutely loves the profession and is very passionate about working to your best ability, working in line with evidence-based practice, and helping you to grow as nurses, but not being nurses that go and follow what everybody else is doing, but nurses that follow what the standards are, that follow the guidance, the guidelines, and the frameworks that we've been taught to work within, and a nurse that is full of passion and joy for the role of nursing. You should be a nursing advocate. You know, they should use your face.
I
reason to get into nursing.
Many times.
Absolutely brilliant. I love that you. So thank you so much, Nurse Angela, and I really hope you have a great evening.
And I think I'll add on, Nzi has been an inspiration to me. She's a great nurse as well. Our path crossed online, and we've ever since been actually empowering each other. Nursing is a go-to profession. We welcome new incomers, and thank you so much, Nzi, for having me on board. I've enjoyed my time with you.